Warning: the health checkups you're getting after 50 could be silently killing you. Shocking new research reveals that some routine tests are doing more harm than good. Your doctor may not even know it, but these screenings could be putting your life at risk right now. Hello, I'm Dr. Klenam, and today we're diving into a critical topic that could save your life or the life of someone you love. If you're over 50 or know someone who is, you need to hear this urgent message. But first, I want to invite you to join our health-conscious community. Simply comment Dr. Klenam below to show you're part of our mission for smarter, safer healthcare. Now let's get to the heart of the matter. We've all been told that regular checkups are the key to staying healthy as we age. But what if I told you that some of these tests could actually be harming you? It's a scary thought, but it's the reality we're facing. Let's start with our first risky checkup: overused cancer screenings. You've probably heard about PSA tests for prostate cancer and mammograms for breast cancer. While these tests can be lifesavers, they're often overused in older adults. Here's why that's a problem: false positives. These tests can flag something suspicious that turns out to be nothing, leading to unnecessary biopsies, surgeries, and emotional distress. Take my patient, John. He's 72 and has been getting annual PSA tests for years. Last year, his test came back slightly elevated. He spent months worrying, underwent an invasive biopsy, only to find out it was a false alarm. The stress alone took a toll on his health. Moving on to our second risky checkup: advanced imaging with radiation, like CT scans. Now, these tests can be incredibly useful when necessary, but they come with a hidden danger: radiation exposure. Each CT scan exposes you to a significant amount of radiation, which can accumulate over time and increase your cancer risk. I had a patient, Sarah, who was getting yearly CT scans to monitor a benign lung nodule. After 5 years, we realized she had received more radiation than some Chernobyl cleanup workers. We immediately changed our approach to protect her long-term health. Our third risky checkup might surprise you: routine cognitive testing for healthy seniors. While it's crucial to catch cognitive decline early, subjecting every senior to these tests can do more harm than good. Why? Because it can lead to overdiagnosis and unnecessary worry. I remember a case where a 68-year-old professor scored slightly below average on a routine test. She became so anxious about developing dementia that she actually started performing worse on daily tasks. It took months of reassurance to help her regain her confidence. Fourth on our list: annual colonoscopies after 50. Now, don't get me wrong, colonoscopies are vital for detecting colon cancer, but doing them every year after 50 is overkill for most people. These procedures come with risks like bowel perforation and complications from anesthesia. For most adults with average risk, every 10 years is sufficient. If you think that's scary, wait until you hear the last one. It's quietly harming more seniors than you realize. But before we get there, let's talk about our fifth risky checkup: full body scans or overly frequent tests like bone density scans or EKGs without symptoms. These might seem like a good way to catch any potential issues, but they often lead to a cascade of unnecessary follow-ups and treatments. I had a patient, Bob, who got a full body scan as a birthday gift from his kids. It found tiny, harmless nodules in his lungs, liver, and thyroid. What followed was a year of invasive biopsies, sleepless nights, and tens of thousands of dollars in medical bills, all for things that would never have caused him any problems. Now for the most alarming one of all: unnecessary medication reviews and adjustments. This might not sound like a checkup, but it's a silent killer hiding in plain sight. Many seniors are on multiple medications, and well-meaning doctors often add or adjust these meds during routine visits. Here's why it's so dangerous: drug interactions and side effects can be devastating in older adults. I've seen patients develop severe balance issues, cognitive problems, and even life-threatening complications from what seemed like minor medication tweaks. Let me tell you about Margaret. She was a vibrant 75-year-old who came in for a routine checkup. Her blood pressure was slightly elevated, so her doctor added a new medication. Within weeks, she was in the ER with dangerously low blood pressure and confusion. It turned out the new med was interacting with her other prescriptions, creating a perfect storm of side effects. This is why it's crucial to only adjust medications when absolutely necessary and to always consider the big picture of all your prescriptions together. So let's recap the 5 health checkups you should be cautious about after 50. 1. Overused cancer screenings like PSA tests and mammograms. 2. Advanced imaging with radiation such as CT scans. 3. Routine cognitive testing for healthy seniors. 4. Annual colonoscopies after 75. 5. Full-body scans or overly frequent tests. And remember our bonus warning about unnecessary medication reviews and adjustments. Making smarter choices about your health checkups after 50 is not just about avoiding unnecessary tests. It's about protecting your quality of life. By being informed and working closely with your healthcare provider, you can ensure you're getting the right care at the right time without exposing yourself to undue risks. Thank you for watching, and remember, your health is in your hands. Stay informed, stay healthy, and I'll see you in the next video.